Hi my friends, this is Dr. Holland here. Welcome to this lecture. We're going to go over cardiovascular condition and disorders. That's going to be our first topic of chapter 6 of the book, Natural and Strength Condition Association, Essentials for Training Special Populations in here. We have chapter 6 and we're going to start with this particular topic about cardiovascular conditions and disorders. We're going to present an introduction to CVD, otherwise known as cardiovascular disease. Is the leading cause of death in the United States, and atherosclerosis or the development of plaque is in the arteries is the underlying cause for this cardiovascular disease. We know that most CVDs are preventable, but there are more factors that we can do in our life than we can modify to decrease the incidence of this disease, such smoking, lipid profile, hypertension, exercise history, sedentary behavior, and diabetes type 2 diabetes. They are all problems that are lifestyle related or health related behavior, and we can have the ability to improve to help to minimize the likelihood of developing CVD's cardiovascular disease. However, some non-modifiable risk factors from CVD include family history, age, and sex. We were born with those three factors, and they have a big impact in our genes, in our genetic makeup. Those factors are not going to move; they are absolute. More about this topic is than we are going to focus in this chapter about cardiovascular conditions in disorders. The first topic we are going to talk about hypertension. The abbreviation is HTN. To better understand hypertension, we must to refer the classification or categories. We have the table over there of the American Heart Association. We must to measure the blood pressure in a person. We are going to read two values of millimeters of mercury: systolic blood pressure and diastolic blood pressure. Anything below 120 on systolic blood pressure and anything below 80 on diastolic is going to be considered normal blood pressure. As you can analyze in the table, a person is diagnosed with hypertension if systolic blood pressure is 140 or higher. The same way for diastolic blood pressure if it's 90 or higher. However, people with systolic values between 130 and 139, they are considered pre-hypertension, and with diastolic between 80 and 90 also are considered with pre-hypertension. So pre-hypertension, you're getting close to hypertension, and it's important to take actions and go in advance for a solution to not develop the disease. The measure millimeters of mercury is just a measure of the metric system, and we can read it with the baumanometer, and the diagnosis of hypertension must to be confirmed in two separate occasions. Sometimes for normal reasons. We have elevated blood pressure. Maybe we are a little bit active, or maybe we are stressed or nervous because of a situation, and to be diagnosed with hypertension, you can have one or both values, systolic or diastolic. It's not mandatory to have both. Now we're going to focus more about hypertension. Factors that can lead to developing hypertension. These factors are diverse. It might be elevated cardiac output, an increase in total peripheral disease resistance, or combination of both. Maybe can be developed from the person's diet who takes too much salt, or is a person made is high sensitivity to salt, making lead a factor or as a result of kidney dysfunction or chronic kidney disease. However, the overwhelming majority, 90 to 95% of cases of hypertension are essentially unknown. We don't know the causes, and the terminology is referred as primary hypertension. Now we're going to focus on a medication. We're going to emphasize in drugs or medication, but it's important to understand, if we talk about medications, we are not medical doctors. We don't need to memorize all the kinds of medication for cardiovascular conditions and disorders. But the reason we need to have specific information about the person how is going to who's going to participate in a exercise program is use the initial screen or an assessment, because we have the history of medication, and remember, medication have a physiological impact on human body, and the effects when person exercise can complicate it. And hypertension people take medication to regulate the disease, to treat the disease. Medication like diuretics, those are essentials to help reduce the fluid load. Examples of medication to regulate hypertension are beta blockers, angiotensin 2 receptor blockers, calcium channel blockers, AC inhibitors, and those medications can help to reduce blood vessel tone and decrease blood pressure in the individuals, because allow more blood flow. People with hypertension sometimes take multiple medication, and medication have side effects, and the effects of those medication on exercise are important to understand for us. Such an example, beta blockers decrease heart rate and hold the heart rate down low. So that might affect our ability to use a heart rate monitor if we are measuring physical activity intensity, especially when doing aerobic exercise. Another fact about medication with hypertension is that affect blood vessel tone to lower blood pressure. It's important to figure it out in our program exercise design not to cause postural hypotension, and avoid moving frequently from lying down to standing position, or vice versa, from standing position to lying down position, because their blood pressure could drop dramatically, which is that is bad and contraindicated for this condition in hypertension. Now we have in here table 6.1. We can analyze slowly the common medications used to regulate blood pressure to treat hypertension. We must remember the presence of side effects. For example, person who is taking cardiac medication such as beta blockers is doing exercise, the heart rate can be around the 70s or the 80s, but they feel like they are working hard. So instead of use heart rate monitor and read the beats per minute to identify the intensity, it's better to use the rate perceived exertion chart or a Borg scale. Now we're going to move to other topics that is about our field, that is about exercise. It's important for clients with hypertension. Then we have a lot of big science foundation that supports a lot of positive effects of doing regular exercise. for people with hypertension, because induce better efficiency of the heart and also can provide their maximal oxygen, can increase the maximal oxygen intake. Aerobic exercise can also decrease their diastolic blood pressure from about 2 to 3 millimeters of mercury, and the systolic can decrease after exercise the blood pressure about 5 millimeters of mercury. So exercise will have positive effect on blood pressure. In addition, by being more active, you are going to lose weight, and you will have a more positive effect to regulate the blood pressure. Now we're going to move to the exercise recommendation. The exercise recommendation for prescription exercise are summarized in table 6.1 and table 6.2. Page 185, we can analyze slowly in the main parameters of this table, but we're going to divide it in aerobic exercise and resistance training. We're going to focus first in the aerobic exercise. About this is important than patients with hypertension. First, the exercise program design should be individualized. All patients are going to be different, but in general, they must do about 30 minutes of aerobic exercise and should occur every single day. We must do evaluating the intensity using the rate of perceived exertion chart, or the also known for short RPE, or the Borg scale in windows of intensity of 12, around 12 is a good number. Is kind of when people can talk easily, 40 to 60% of the VO2 max or heart rate reserve. That's a good intensity for this population. But again, the use of beta blocker medication is going to impact in the intensity parameter of heart rate, and is better use RPE or Borg scale. An important fact, very interesting about exercise, is that blood pressure is reduced after exercising. Blood pressure can go down for 2 hours after exercise. So perhaps rather doing one continuous session of 30 minutes of aerobic exercise, it might actually be more beneficial to design multiple short exercise exercise session throughout the day. That will keep the blood pressure lower for longer period of time. And for example, 15 minutes in the morning and 15 minutes in the afternoon can be a good options. So clients will reach longer, more effective time of reduction in the blood pressure. Now we have in here in the next slide the same table and the page we can analyze in the main parameters to do resistance training on clients with hypertension. We're going to summarize it in here. Resistance training 2 to 3 days a week of moderate intensity is recommended, with parameters of 8 to 12 repetitions at 60 to 80% of their 1 rep max. It's usually appropriate circuit workout training format. It is beneficial for this population, and we must be prudent about the intensity with heavy loads and breathe properly, because for these individuals lift heavy loads or volume, they should not breathe properly. They will tend to perform the Valsalva maneuver, and it's contraindicated for a person with hypertension. holding the breath, because that increase the blood pressure. Now we have finally then we must to conduct an extended warm up, an extended cool down. Those factors are strongly advised, strongly recommended for this population. Another important fact is about this topic is we must to stop over the exercise for clients with hypertension if we evaluate blood pressure and goes up about 220 millimeters of mercury on systolic, or 105 millimeters of mercury on diastolic. That is termination criteria to stop exercising immediately. Now remember, to better understand the topic, the client with hypertension, go to the book Essentials of Training Special Population, read the key points and the key terms, answer the study questions, and carefully analyze the case study that is very close to the reality for this person with hypertension. And it's important to understand the technique to read and to evaluate the blood pressure if we are going to work with these individuals. See you in the next lecture.